Hi everyone. Today I will present a case study entitled Spinal Cord Injury and Autonomic Dysreflexia, which is a case report on an overlooked complication of spinal cord injury by Ahmad and was published in 2022. Before that, let me introduce myself. So, my name is Ifa Dirabite Ismail. I am a student from UNIZA. Okay, in the first slide, let's we talk about the patient background. So the patient in the article stated that was a 48 years old male with a complete T1 spinal cord injury, SCI, classified as ASAIE, following a road traffic accident 16 years ago. He also had a neurogenic head bladder dysfunction and recurring urinary tract infection. He also stated that previously he had multiple clinic visits and hospital admission with similar symptoms. However, the symptoms were repeatedly treated as urinary tract infection, and the autonomic dysreflexia remained unyet diagnosed. So next, let's talk about presenting symptoms. So, during his recent admission, he complained of severe sweating, throbbing headache, anxiety, difficulty urinating, and increased lower limb specificity. Physical examination showed excessive sweating above the nipple line, high blood pressure of 187 over 110 millimeters of mercury, and the body temperature of 34.6 degrees Celsius, and bradycardia with a heart rate of 46 per minute. So what's the meaning bradycardia is the lower heart rate. So next, let's talk about the causes of autonomic dysreflexia in this case. So first is the patient was found to have several possible triggers of autonomic dysreflexia. Next, these include bladder over distension, urinary tract infection, tight sock, and clotting, and chronic bladder dysfunction. And the last one is the patient paused void. Residual urine volume was 236 millimeters, suggesting incomplete bladder emptying. So next, let's talk about the management. So, the healthcare team immediately reassured the patient, removed his tight socks and coating, positioned him upright, and performed clean intermittent catheterization. Within a few minutes, his blood pressure reduced from 187 over 110 to 149 over 88 millimeters of mercury. His body temperature and heart rate also improved. Also, the urine culture later come from Klebsiella pneumonia infection, and appropriate antibiotics were started. So, for your information, Klebsiella pneumonia is a bacterium that causes urinary tract infection. This infection was one of the triggers of the patient autonomic dysreflexia. So, appropriate antibiotics were started to treat the infection. So for the outcome, and education. Before he discharged, the patient received the education regarding autonomic dysreflexia, including its causes, prevention strategies, and emergency management. He was also given an alert card to help healthcare provide, recognize, and manage a future episode more effectively. So lastly, let's talk about the conclusion. To summarize, autonomic dysreflexia, AD, can be a life-threatening condition associated with spinal cord injury, patient at T6 level and above, due to various doses stimuli below the neurological level of injury. Data distinction appears to be the trigger in the most of the case report. AD can be easily missed. Try medical staff unfamiliar with this condition. Patient and healthcare provider education at the true evaluation are essential for this diagnosis and management.